Do you want to be healthier, yet you just don't know what to do? All these shows telling you this and that, but nothing seems to work. Well, listen close. Golden State Media Concepts has got something great for you. The Health and Wellness Podcast dedicated to workout trends, healthy eating habits, diet, and everything about healthy living. Join us in our banters as we help you not just live life to the fullest, but live it to the healthiest.
Thank you for tuning in to the GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'm your host, Alex. Today, I want to talk with you guys about non-steroidal anti-inflammatory drugs, or NSAIDs. A lot of us take these commonly every day for pain and fevers, but there's a lot to really know about them. First off, we're going to talk about what they are. We're going to also discuss how they work and implications for different types of ailments. So let's start with, what are non-steroidal anti-inflammatory drugs? So NSAIDs are the medications that we take for relief when we have back pain, headaches, arthritis, if you have a fever, or also if you're having menstrual cramps. You take an NSAID each time you take an aspirin or an Advil or a Aleve. They're just common pain relievers and fever reducers. So you are already probably taking them even if you're unaware that they fall under this classification. Aspirin, ibuprofen, and naproxen sodium are the three most common types. You may know them as also being Excedrin, which is aspirin, ibuprofen is Motrin or Advil, and naproxen sodium is under the brand name Aleve. You can easily acquire these over the counter in drugstores and supermarkets, and you can also get the generic versions quite easily. Acetaminophen or Tylenol is not an NSAID. It is a pain reliever and a fever reducer, but it does not have the anti-inflammatory properties that is a requirement to make it an NSAID. So if you are having a fever or you need pain relief, then Tylenol may be appropriate for you. But if you're trying to relieve inflammation, then you're going to want to reach for a different NSAID. Acetaminophen is sometimes also combined with aspirin in over-the-counter medications like certain varieties of Excedrin. So what do we take these NSAIDs for? A lot of folks take them for pain associated with arthritis, including osteoarthritis and rheumatoid arthritis. Personally, I am prone to tendinitis in my wrists from typing so much, so I may reach for an NSAID to help treat the inflammation from that. It is also useful for muscle aches, backaches, dental pain, any pain associated with gout, bursitis, and menstrual cramps. You can also use it to reduce your fever or relieve minor aches associated with common colds, and I think that's a pretty frequent use for it. How do they work? Well, NSAIDs block the production of specific chemicals in your body that cause inflammation. They are really good at treating pain caused by slow tissue damage, like arthritis pain. NSAIDs also work really well at fighting back pain, menstrual cramps, and headaches by working like corticosteroids. A lot of them are very helpful in reducing the inflammation without having any of the side effects of steroids. Steroids are drugs that are man-made and are very similar to cortisone, which is a hormone that naturally occurs in your body. Like cortisone, NSAIDs reduce pain and inflammation that often are associated with joint and muscular diseases and injuries. However, the TLDR is that you should only take an over-the-counter NSAID for 3 days continuously for fever and up to 10 days for pain, unless your doctor says that it is okay. Over-the-counter NSAIDs work well in relieving pain, but they are meant to be temporary or short-term products. If your doctor tells you it's okay to take NSAIDs for a long period of time, you and your doctor do need to watch out for some harmful side effects. If you notice bad side effects, then your treatment may need to be changed, and it's important for your doctor to talk about that with you. Some common side effects of NSAIDs may be gastrointestinal distress, so symptoms like gas, feeling bloated, heartburn, stomach aches, nausea, vomiting, diarrhea, or constipation. These symptoms may generally be prevented by taking it with food. So I know we think of antibiotics as being a major one that we take with food, but you can also take ibuprofen and other NSAIDs with food to help reduce these GI symptoms. So you can take that with food, milk, or antacids like Maalox or Mylanta. If these symptoms continue for more than a few days, even if you're taking your NSAIDs with food, milk, or antacid, then you need to call your doctor because your NSAID may need to be stopped or changed. Other effects of NSAIDs may include dizziness, feeling lightheaded, having trouble balancing or concentrating, or having some mild headaches, which is a little ironic since you're taking it for aches and pains. If those symptoms last for more than a few days, stop taking the NSAID and call your doctor. If you have any of these side effects, you should call your doctor right away. In the gastrointestinal urinary section, we have black stools. So if they're bloody, black, or tarry, if you start having bloody or cloudy urine, severe stomach pain, blood or material that looks kind of like coffee grounds in your vomit, so that may be bleeding that is associated without warning. You may not even have pain associated with it, but it's in your vomit anyway. You may have an inability to pee or a change in how much you're able to pass urine, any unusual weight gain, or jaundice, so that yellowish appearance in your body tissues. For your head, it may affect you by having blurred vision, ringing in your ears, greater sensitivity to light, having a very bad headache, or a change in strength on one side that's greater than the other, trouble speaking or thinking, or a change in balance. So you may recognize that as symptoms of a stroke. You may also have possible allergic reactions or issues related to severe rashes, hives, or red peeling skin, itching, bruising or bleeding that may be unexplained, feeling very tired and weak, getting bad back pain, acute fatigue or flu-like symptoms, chest pain, heart palpitations or rapid heartbeat, wheezing, trouble breathing or unusual cough, or having a lot of fluid retention, so like swelling around your mouth, lips, tongue, or face, or swelling around your ankles, feet, lower legs, hands, or even possibly around your eyes. Those may be related to a possible allergic reaction to NSAIDs. And if you have any of these side effects that I just listed, then it's important to call your doctor right away and immediately stop taking the NSAID. Your doctor will be able to discuss with you what you should do next. Overall, that may sound very scary, but these side effects tend to be rare. They have to list the side effects if anyone has experienced them in clinical testing, so do not panic. For the most part, many of us take NSAIDs fairly regularly without having any of these side effects. It's just important to know what could happen and to be aware that we might need to reach out to a doctor in certain circumstances. All right, we're going to go on a quick break. And when we come back, we are going to discuss how doctors decide which NSAIDs are right for us and if there are any specific warnings associated with NSAID use aside from the side effects that I just discussed.
Are you looking to learn more about the latest trends from the fitness world? Are you confused by all of the different trends that are out there? The GSMC Fitness Podcast is the place for you. The GSMC Fitness Podcast is the place to come for people of all skill and interest levels. Join us as we explore the latest trends in the fitness world. Does that new exercise really work? Should I try yoga? Whatever your question, chances are good you'll find an answer on the GSMC Fitness Podcast.
Information regarding non-steroidal anti-inflammatory drugs, or NSAIDs, and the potential side effects. Now we're going to discuss how doctors pick which NSAIDs are right for us individually and the associated warnings with NSAID use. So when your doctor is planning your treatment, they're going to look at the effectiveness and risks of different NSAIDs. So although they are classified in the same group, they often will be a little bit different in how it may affect each individual. So your doctor is going to take into account your medical history. They may perform a physical exam or issue an order for x-rays or have you give some blood tests and check for any other medical conditions that you may have in addition to the one that is indicating that you should be on an NSAID. After you start your NSAID program, your doctor is going to perhaps ask you to meet regularly to check for any harmful side effects and to make any changes as needed. That may include needing some blood tests or other tests like kidney function tests to determine what else may be necessary for your treatment. So with NSAIDs, you do need to make sure you're drinking plenty of water. That is one of the reasons that they will issue a kidney function test request. So just make sure you're drinking at least those 8 glasses of 8 ounces of water each per day, and perhaps drink more if you are on NSAIDs for any type of frequency. The FDA requires that NSAIDs are labeled with the following specific warnings, and these are specifically for non-aspirin NSAIDs. They can increase the chance of heart attack or stroke, and that risk may be higher if you have heart disease or risk factors associated with heart disease, like smoking or high blood pressure or high bad cholesterols or diabetes. The risk may also be increased in folks who don't have heart disease or any of the risk factors mentioned, and that risk can occur early in your treatment, and it may increase the longer you use the NSAIDs. That's why they try to keep you on 3 days max for fever and 10 days max for pain, unless your doctor has said otherwise. Heart issues that may also be caused by non-aspirin NSAIDs can happen within the first few weeks of use, and they may occur more frequently at higher doses or with long-term use. Non-aspirin NSAIDs should also not be used right before or after heart bypass surgery. So make sure that you're paying attention for yourself and your loved ones when the doctor is going through the list of what you can and cannot do or use at that time. The following warning is for all NSAIDs, including aspirin. So NSAIDs can increase the chances of you having serious stomach and bowel side effects, like ulcers and bleeding, and those side effects can occur without warning signs, like we mentioned in the previous segment regarding bleeding and throwing up and having blood in your vomit. You might not even have pain associated with it. So this risk is greater in folks who are older, who may have had a previous history of stomach ulcers or bleeding issues, who are on blood thinners. If you drink 3 or more alcoholic beverages per day, remember that the recommendation for that is for age 65 and under. Males who are otherwise healthy can have up to 2 alcoholic beverages per day, and females up to 1. So if you are on multiple prescriptions or over-the-counter NSAIDs, you may also be at a greater risk of having these serious stomach and bowel side effects. So those are just some things to be aware of and to watch out for. If you start experiencing them, then it may be related to the NSAIDs and may not be just a secondary issue. Can you take NSAIDs if you're being treated for high blood pressure? You might want to talk to your doctor about that. NSAIDs have been found to cause high blood pressure in some folks, otherwise known as hypertension. You might have to stop taking the NSAIDs if you notice your blood pressure is increasing, and that includes even if you're taking blood pressure medication and following your diet. So ask your doctor about that before you start taking NSAIDs. I feel that a lot of times we just take for granted the fact that we can reach for ibuprofen or a lot of these other NSAIDs like aspirin or naproxen if we need to for like pain and stuff, because we're just like, oh, okay, yeah, we can get that across the counter, over the counter, and just get them off the shelves in either brand name or generic form. And that ease of access tends to make us feel that there's probably nothing else wrong with them. But I think that it's important to be mindful that they can still have side effects, just like how taking certain vitamins can impact your medication that you're getting from your doctor. So we want to make sure that we still ask a doctor if we are on other types of medication, whether it is safe to take these NSAIDs. So here are some recommendations for specifically when you should check with your doctor before taking NSAIDs, although you are also welcome to ask them if you are on any other medications or have any other conditions that are not listed here. One of the most important ones is pregnancy. So in pregnancy, you should not take NSAIDs in the 3rd trimester, and you should talk to your doctor about using them in the 1st or 2nd one. Children and teens who have viral infections, even if they're not accompanied by a fever, should not take aspirin or aspirin-containing products because of the risk of developing Reye syndrome. Reye syndrome is a disease primarily found in children, but it can actually occur at any age, and it affects all organs of your body, but is especially harmful for your liver and your brain. It can cause a large increase in pressure within the brain and is frequently also associated with massive accumulations of fat in your liver and other organs. And we discussed in the diabetes episode how that is particularly problematic for your body. RS, or Reye syndrome, is defined as a 2-phase illness because it generally also occurs at the same time with a previous viral infection, such as the flu or chickenpox. The disorder is also commonly occurring during recovery from a viral infection, but it can develop up to 3 to 5 days after the onset of a viral illness. It is very frequently misdiagnosed as being encephalitis or meningitis, diabetes, a drug overdose, a poisoning, or some kind of psychiatric illness in addition to SIDS. So symptoms of RS include persistent or recurrent vomiting, listlessness, personality changes like irritability or combativeness, confusion or disorientation, delirium, convulsions, or even a loss of consciousness. So if you see someone, particularly a child, coming down with these symptoms during or soon after a viral illness, make sure you reach out to a doctor ASAP and follow the recommendations that they provide for you for that. The symptoms of RS in infants don't tend to follow a typical pattern, so they may not even always have vomiting, and epidemiologic evidence indicates that aspirin is a major preventable risk factor for Reye syndrome. So just keep that in mind, especially when you have kids who may be taking NSAIDs. You want to make sure that they are not receiving aspirin or aspirin-containing products, and that is why. So that includes a lot of forms of Excedrin. You want to keep an eye on that. Anyone who has an upcoming surgical procedure, including dental surgery, should not be taking NSAIDs. So don't take ibuprofen or anything like that when you're going to have your wisdom teeth removed as a preemptive measure to make it less painful. You want to definitely avoid that. You also want to avoid it if you have 3 or more alcoholic beverages per day, as it can make you more prone to bleeding. And for asthma that gets worse when taking aspirin, again, talk to your doctor about that. And if you are age 65 or older, you should also check with your doctor before taking NSAIDs, even if you are not on any other forms of medication or have any of these other risk factors. All right, we're going to go on a quick break, and when we come back, we're going to talk some more about NSAID risk factors and allergic reactions.
Tired of searching the vast jungle of podcasts? Now listen close and hear this out. There's a podcast network that covers just about everything that you've been searching. Hey! The Golden State Media Concepts Podcast Network is here. Nothing less than a podcast bliss with endless hours of podcast coverage. From news, sports, music, fashion, cooking, entertainment, fantasy, football, and so much more. So stop lurking around and go straight out to the Golden State Media Concepts Podcast Network. Guaranteed to fill that podcast itch. Whatever it may be. Visit us at www.gsmcpodcast.com. Follow us on Facebook and Twitter, and download us on iTunes, SoundCloud, and Google Play.
Speak with a doctor before taking NSAIDs and how it may have side effects related to high blood pressure. Now we're going to talk about some more cases in which we should speak with a doctor before taking NSAIDs to check if it's okay for us to do so. Because as we mentioned, just because it's easy to acquire does not mean it's necessarily safe for everyone in all circumstances to reach for it when you are having aches and pains or fevers. So, in a continuation from our last segment, we also want to talk to a doctor prior to taking NSAIDs if we have certain types of diseases like known kidney or liver disease, because it can promote the accumulation of fat in our liver, and it can also cause some problems with urination and kidney disease. In that vein, if you have diabetes that is giving you problems in keeping it under control, definitely also speak with your doctor. Remember that when we discussed the diabetes episode, that certain types of problems in processing insulin can lead to accumulation of fat in your liver, just like taking a lot of NSAIDs can. So this can potentially exacerbate a problem you are already experiencing. So make sure you talk with your doctor first if you have diabetes that is difficult to control and you're considering taking NSAIDs. If you have gastroesophageal reflux disease or GERD, you should speak with your doctor first, as well as if you have Crohn's disease, ulcerative colitis, or active peptic ulcer disease. So that means stomach ulcers or any previous history of having bleeding stomach ulcers. Heart and bleeding conditions that may prompt you to ask a doctor first if NSAIDs are right for you include any history of prolonged bleeding or for folks who bruise easily. If you have high blood pressure that's difficult to control, active congestive heart failure, or a history of stroke or a heart attack, speak with your doctor. For allergies and drug interactions, there are known allergies to medications, including aspirin, other NSAIDs, and sulfa drugs. If you have any of those allergies in your medical history or someone in your family may have had them, then talk to your doctor first. If you have nasal polyps, that's been linked to a greater chance of developing an NSAID allergy. So definitely talk to your doctor. Also check with your pharmacist or healthcare provider before you start an NSAID to determine if your current medications, whether they are prescription or over-the-counter, as well as your dietary or herbal supplements, are compatible with NSAIDs. This is especially important if you're on warfarin, also called Coumadin, clopidogrel, which is Plavix, any type of corticosteroids like prednisone, phenytoin like Dilantin, cyclosporines like Nerol, Sandamune, probinicids, and lithium like Lithobid as well. If you take diuretics, which are better known as water pills in a lot of ways to help control your blood pressure, you may also be at greater risk of kidney problems if you take them with NSAIDs. And when I say taking them with NSAIDs, that does not mean at the same time. It just means if you are on these diuretics and you take an NSAID at any point, then it may cause you to be at greater risk for kidney problems. So definitely talk to your doctor before reaching for that ibuprofen. Interestingly, and perhaps somewhat surprisingly, some non-prescription NSAIDs are sweetened with aspartame, which is a source of phenylalanine. Phenylalanine is an amino acid, which is the building blocks of proteins. So a lot of food protein sources contain phenylalanine. If you have phenylketonuria, or PKU, which is a genetic inherited condition that causes levels of phenylalanine to build up in the blood, you should not be taking NSAIDs. You need to speak with your doctor to find out which ones have that aspartame sweetener. So a lot of those coated NSAIDs are going to have that and may cause you some problems, even though they do not tend to have protein in them. They will still have phenylalanine, some of those amino acids. So be mindful of that as well. NSAIDs can cause allergic reactions, and in rare cases, an NSAID can cause a generalized allergic reaction known as anaphylactic shock. If you have watched the X-Files movie from 1998 called Fight the Future, you may recall that Scully gets stung by that Africanized honeybee and ends up going into anaphylactic shock. So anaphylaxis is a severe, life-threatening allergic response that may cause swelling, lowered blood pressure, hives, shortness of breath, wheezing, difficulty swallowing, and even a loss of consciousness, which we saw Scully have pretty much all of those reactions in her presentation of anaphylaxis in the movie. Normally, when you have an allergic reaction, the body's immune system overreacts by releasing chemicals that cause those itchy, watery eyes and the runny nose, those normal but annoying signs of an allergy. But in some people, this reaction can be more severe, and anaphylaxis is that result. So in those cases, people can go into anaphylactic shock. So their blood pressure is going to drop severely, and you'll get swelling in the bronchial tissues, so in your lungs, and that causes symptoms of choking and even a loss of consciousness. If anaphylactic shock is not treated immediately, it can be fatal. So if you or someone you are around is experiencing these swollen eyes, lips, or tongue, difficulty swallowing, shortness of breath, rapid heart rate, chest pain or tightness, you need to call 911 or have someone drive you to the nearest emergency room ASAP. If someone is going to get anaphylactic shock from an NSAID, it's usually going to occur very soon after the person starts taking the NSAID. Before you take any medication that is prescription, make sure you tell your doctor if you're allergic to any medications, foods, or other substances. If you currently take any other medications like over-the-counter meds or herbal or dietary supplements, tell them. Also tell them if you're pregnant, planning to become pregnant, or are breastfeeding, if you have any problems taking meds, or if you have anemia, kidney, liver disease, stomach or peptic ulcers, heart disease, high blood pressure, bleeding or clotting issues, or asthma or growths in the nose, like nasal polyps. Your doctor may need to give you a different type of medication. You can get NSAIDs from your doctor in prescription form as well. A lot of folks in the military get those 800 milligrams of ibuprofen. So if you see your military friends with those horse pill ibuprofens, that is generally what those are. And you can get those from a regular non-military civilian doctor as well, depending on whether your doctor feels it's called for. So remember, when you go into your doctor and they ask if you are allergic to anything, go ahead and tell them everything you are allergic to. It may seem silly in the moment to go, hey, I'm allergic to these types of antibiotics, but also to bees and certain types of shampoo, and it causes me to break out in hives. But it's important for your doctor to know that. And I think that the phenylalanine inside of the coatings of some of these NSAIDs is an especially important reminder of that. It can be in surprising products. You never know exactly what goes into each of these products. So if you have celiac disease and you have to deal with gluten sensitivity issues, then you may be especially aware of that. But there are a lot of surprising elements added to different products to sometimes make them more palatable or serving as a binder for different products. So just make sure that you do list out all of those allergies, even if it seems like it is out of nowhere, because you never know what has to be added to a lot of these products or just what is added to try to make things more palatable. We're going to go on another break, and when we come back, we're going to discuss differences between types of NSAIDs. Stay tuned.
The GSMC Life and Happiness Podcast takes you on a journey of exploration. We'll discuss tried and true methods alongside the latest trends of how to best live your life to its fullest and happiest. From psychology to meditation, science to self-help books, the GSMC Life and Happiness Podcast will help you to discover what makes you happy and how you can live life being the best you possible. Download the GSMC Life and Happiness Podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Welcome back. Before the break, we were talking about different health side effects and allergies that may be associated with NSAIDs. Now we're going to talk about how NSAIDs specifically work and what differences there are between each type. First off, NSAIDs are used to combat prostaglandins. So prostaglandins are a family of chemicals produced by cells in your body, and they have several different important functions. They promote inflammation that is often necessary for healing, but is a side effect that can cause pain or fever. Prostaglandins also help support the blood clotting function of your platelets and protect the lining of your stomach from any damaging effects from the stomach acid. Prostaglandins are produced in your body cells by the enzyme cyclooxygenase, which is frequently referred to as COX. So there are two COX enzymes, COX-1 and COX-2. Both of those enzymes produce prostaglandins that promote inflammation, pain, and fever. However, only COX-1 produces the type of prostaglandins that support platelets and protect the lining of your stomach. Non-steroidal anti-inflammatory drugs block the COX enzymes and reduce prostaglandins throughout your body. So because of that, ongoing inflammation, pain, and fever are reduced. Since the prostaglandins that protect your stomach's lining from stomach acid and support platelets and blood clotting are also reduced, that's why NSAIDs can lead to stomach ulcers and promote more bleeding. There are differences between certain groups of NSAIDs. They vary in their potency, how long they take to act, and how long they continue to act, how they are eliminated from your body, and how much they inhibit the COX-1 versus COX-2 enzymes. So, the more an NSAID blocks COX-1, the greater its tendency to cause ulcers and promote bleeding. So one particular NSAID, Celebrex, tends to block COX-2 and has very little effect on COX-1. So it's also classified as a selective COX-2 inhibitor. Selective COX-2 inhibitors, such as Celebrex, cause less bleeding and fewer ulcers than other NSAIDs. That's one reason why it's really important to have these discussions with your doctor, because not all NSAIDs are created equal and they do act very differently depending upon which type you get. They may have secondary classes in addition to being considered NSAIDs. Aspirin is also unique as an NSAID because it is the only NSAID that inhibits the clotting of blood for a prolonged period of time, and that's really 4 to 7 days. That prolonged effect of aspirin is what makes it really ideal for preventing blood clots that can cause heart attacks and strokes, and that is why a lot of folks have heard doctors say an aspirin a day. Now, most NSAIDs inhibit the clotting of blood for just a few hours. Ketorolac, or Toradol, is a very potent NSAID, and it is often used for moderately severe acute pain that would otherwise perhaps require a narcotic. Ketorolac causes ulcers more frequently than other NSAIDs, though. That's why you can't use it for more than 5 days. A lot of NSAIDs have a similar mechanism of action, and individuals who don't respond to one particular NSAID may respond well to another one. So you don't necessarily have to brush aside NSAIDs, period. If those are not working for you, you just need to speak with your doctor and perhaps they can find one for you that you'll perhaps be more responsive to. Again, remember, we're all individuals, and although as humans we have a ton in common, but there are also just individual differences sometimes, just like with allergies, regarding drug sensitivities. So, which drugs do NSAIDs interact with? Well, NSAIDs reduce blood flow to your kidneys. And that means that if you are taking water pills, those diuretics we discussed earlier, it's going to reduce the action of those water pills and also decrease the elimination of certain drugs from your body, like lithium or methotrexate. As a consequence of that, the blood levels of those drugs may increase, which in turn may also increase the likelihood of having their side effects or the magnitude of the side effects. NSAIDs can also decrease the ability of the blood to clot, and that means it's going to increase bleeding. When you use NSAIDs in combination with other drugs that may also increase bleeding, like warfarin or Coumadin, then there's an increased likelihood that you may have serious bleeding or complications of bleeding. That's why folks who are taking drugs that reduce the ability of your blood to clot should avoid using NSAIDs for a prolonged period of time. NSAIDs can also increase your blood pressure, especially in patients with hypertension, and that means that it can antagonize the action of the drugs that are used to treat hypertension. NSAIDs can also increase the negative effects of cyclosporine on your kidney function. Cyclosporine is a drug that reduces your body's ability to fight illnesses and diseases. It's an immunosuppressant, so it can leave patients vulnerable to infection or other problems, including cancers like lymphoma. Using other drugs that treat organ transplant rejection along with cyclosporine can also increase those tendencies, because cyclosporine can also cause high blood pressure and kidney problems. That's why you cannot use NSAIDs in combination with cyclosporine. It's just a double whammy on your kidney function. Additionally, if you drink more than 3 alcoholic beverages per day, it may give you an increased risk of developing stomach ulcers if you are also taking NSAIDs. So definitely avoid that as well. That means you need to be very aware of that if you do drink a lot and you drink frequently, because the first thing that a lot of us tend to reach for if we have a hangover is going to be an NSAID. But you want to be careful with that because it can give you an increased risk of those stomach ulcers, which is going to be bad news bears and just a bummer of a time when you are dealing with that cycle. We're going to go on another break, and when we come back, we're going to talk about the implications for ibuprofen with coronavirus. Stay tuned.
Are you tired of the same old news? Are you sick of the seemingly endless political spin and negativity? The GSMC America Still Beautiful podcast is a weekly news podcast covering all the top positive and uplifting news stories. We cover stories that will inspire, uplift, and remind you of the good in the world. Tune into the Golden State Media Concepts America Still Beautiful podcast to get all the great and positive news stories of today. Download the GSMC America Still Beautiful podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Welcome back. Before the break, we were discussing how NSAIDs work by blocking the COX enzymes and reducing prostaglandins throughout the body. We also discussed the differences between NSAIDs and how they can have secondary classifications, as well as which drugs tend to interact with them and why. So now I would like to talk to you guys about how NSAIDs work with coronavirus. So I know there's been a lot of information out there lately stating that folks should take paracetamol/acetaminophen, Tylenol, instead of NSAIDs right now from worries that ibuprofen may worsen coronavirus. It's gone viral on the internet, and health experts are actually saying that there's no credible scientific evidence at this time to substantiate that concern. It spread very widely as a rumor after the French health minister tweeted that taking ibuprofen and other anti-inflammatory drugs might worsen an infection. And he suggested that acetaminophen may be preferable, but to still defer to your physician if you're already taking anti-inflammatories. That tweet appeared because of a letter published in the Lancet on March 11th stating that coronavirus binds to ACE2 receptors on the surfaces of cells, and that theoretically, medications that work by stimulating those receptors, like ibuprofen, may actually worsen coronavirus and lead to poorer outcomes. However, that is just a hypothesis. Right now, it is an interesting observation, and infectious disease experts are trying to research this more because we're learning a lot about the unknowns of this virus. It is a novel coronavirus. That means we've never encountered it before, and there is a lot of research that still needs to be done. So this is hypothetical, and there is no hard data right now saying that ibuprofen puts you at any kind of disadvantage or interferes with the inflammatory response of the body such that it can't fight off the virus, according to Dr. William Schaffner, an infectious disease expert at Vanderbilt University. So more research is needed to evaluate reports that ibuprofen may affect the course of COVID-19, and it's important to keep in mind the difference between correlation and causation, in this case, just like in any other type of research that we've discussed previously on this podcast. Just because you see reports that folks who have died from contracting COVID-19 have had ibuprofen in their systems does not mean that the ibuprofen is what caused it or made it worse. It merely means that they had symptoms related to inflammation or fever or pain that prompted them to take an NSAID like ibuprofen. So they are doing more research on that right now, and there is no reason, according to the experts right now, to avoid ibuprofen due to COVID-19 unless you have other conditions that would require you to avoid it. That is a direct quote from an infectious disease doctor at the Cleveland Clinic. Meanwhile, the makers of Tylenol have said that it's experienced some consumer-driven demand for their products, and there is no shortage of these drugs that are anticipated right now. So just keep that in mind as you go forward. We want to make sure that we don't panic just because someone has this going viral online or the World Health Organization says that it's gathering evidence on the topic. They've performed a preliminary literature review, which is one of the first steps that you take when you are conducting any type of research, and they are not aware of published clinical or population-based data on this particular topic. So this is a hypothesis at this point only. Now, if you are concerned about that, then by all means, go ahead and swap to Tylenol. But if you go to the grocery store or the pharmacy and they are out of Tylenol because people have panic bought it, don't worry. You can take another form of NSAID right now, according to all the infectious disease experts within the United States right now, unless otherwise indicated by your doctor. Even the authors of that study in the Lancet Respiratory Medicine Journal that came out on March 11th have explicitly stated that this is only a hypothesis. Some tests with rats have shown that ACE inhibitors actually upregulate ACE2 in heart cells, and tests with diabetic mice have shown that ibuprofen can have an influence on that regulatory system. But these were in mice. These studies were performed with mice, and if we've discussed before, sometimes we have a lot in common with mice, and sometimes it's not exactly the same. So without strong data and evidence to back up this hypothesis, it is merely a hypothesis right now. They're going to study it, and they may see in the future that this warning may be correct, or this hypothesis may not hold weight. Forming a hypothesis is one of the first steps in the scientific method, and then you test that hypothesis. Not all hypotheses that are tested turn out to be correct. In fact, a lot of them turn out to be incorrect. And in the scientific community, we still find that to be a valuable contribution to the body of research. So this is an interesting hypothesis that they have posed, but it does not necessarily mean that it is a correct hypothesis. So I urge you to not panic. Just speak to your doctor if you are on ACE inhibitors or if you are taking an NSAID like ibuprofen that affects ACE2 regulation. One thing you should be doing regardless though, if you are infected or hospitalized with COVID-19, is to make sure you're getting enough fluids. Whenever your liver cells are inflamed or damaged, they can leak higher than normal amounts of enzymes into your bloodstream. Elevated liver enzymes don't always mean that you have a very serious problem, but they found that was a typical lab finding in many people with SARS or MERS, which we discussed in our coronavirus episode. I read the article in the Lancet Journal of Respiratory Medicine, and it was called "Are Patients with Hypertension and Diabetes Mellitus at Increased Risk for COVID-19 Infection?" This is the study that prompted folks to think that ibuprofen could be problematic for it. And in this study, they found signs of liver damage in a person who had COVID-19. The doctors involved in the research say it's not clear if it was the virus or the drugs being used to treat the person, the ibuprofen, that caused the damage. So they are not sure one way or the other. Some people who've been hospitalized with COVID-19 have also had acute kidney damage and have sometimes required a kidney transplant. That also occurred with SARS and MERS. During the SARS outbreak, some scientists even found that the virus that caused the illness was in the tubules of the kidneys. There is little evidence to show that the virus directly caused the kidney injury, though, according to a World Health Organization report. So that's why they're still trying to sort this out. Dr. James Cherry, who's a research professor of pediatrics at the David Geffen School of Medicine at UCLA, says the kidney damage may be due to other changes that happen during a coronavirus infection. When you have issues like pneumonia, you have less oxygen circulating, and that can also damage the kidneys. So when you are having these respiratory illnesses, you are having less oxygen circulating, and that can damage your kidneys. So it's not necessarily coronavirus itself, and it's not necessarily ibuprofen. It just may be a secondary effect from something else that is going on with coronavirus. We're going to go on a quick break, and when we come back, we're going to wrap up this episode by discussing the actual Lancet journal article. Stay tuned.
GSMC Beauty Tips Podcast gives you advice on everything from hair to fashion to skincare products. We'll talk about the latest trends in makeup, hairstyles, and anti-aging remedies. And we'll cover all of the newest fashion trends. If you have an interest in or questions about the beauty trends that might work best for you, the Golden State Media Concepts Beauty Tips Podcast has got you covered. Download the GSMC Beauty Tips Podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Welcome back. Before the break, we were discussing how there have been recently some concerns regarding taking NSAIDs like ibuprofen in folks who have coronavirus symptoms. And this has come from an article in the Lancet Journal of Respiratory Medicine, published on March 11th, 2020, on Are Patients with Hypertension and Diabetes Mellitus at Increased Risk for COVID-19 Infection. The authors are Lei Fang, George Karakoulakis, and Michael Roth. So this study was not about ibuprofen in and of itself, but rather about whether patients who already have hypertension and diabetes mellitus at a higher risk of infection from COVID-19. So they were studying comorbid disorders or comorbidities. So comorbid means that you have a simultaneous presence of 2 or more chronic diseases or conditions in a patient. So that just means you have more than one thing going on. For example, in this case, whether folks have COVID-19 and hypertension or COVID-19 and diabetes mellitus. That's all it means. So they studied 32 non-survivors from a group of 52 intensive care unit patients who had COVID-19. They found that 22% also had cerebrovascular diseases and another 22% had diabetes. In another study, they found that out of 1,099 patients who had confirmed cases of COVID-19, 173 of them had severe disease with comorbidities of hypertension at 23.7%, or diabetes mellitus at 16.2%, coronary heart disease at 5.8%, and cerebrovascular disease at 2.3%. Fang et al., who released this publication on March 11th, also looked at a third study of 140 patients who were admitted to the hospital with COVID-19. They found that 30% of these 140 patients had hypertension and 12 had diabetes. So the most frequent comorbidities that they have found in these 3 different studies are often treated with ACE inhibitors, but treatment was not assessed in either of the studies, and the authors very clearly point that out. So different type of SARS viruses, remember SARS stands for Severe Acute Respiratory Syndromes, and SARS coronaviruses, or SARS-CoV and SARS-CoV-2, are human pathogenic coronaviruses. So they spread in humans and they cause disease. They bind to the target cells in your body through converting the ACE2 enzyme, which is then expressed by the lining cells of your lungs, intestines, kidneys, and blood vessels. So expressing ACE2 is also substantially increased in folks who have type 1 or type 2 diabetes who are treated with ACE inhibitors or angiotensin II type 1 receptor blockers, or called ARBs. You also treat hypertension with ACE inhibitors and ARBs. And what these drugs do is upregulate ACE2. Upregulation means that it increases the number of receptors on the surface of those target cells in your body. And by target cells, we mean the cells that are being impacted by coronavirus, and that can make the cells more sensitive to a hormone or another agent, in this case, coronavirus. The fact that ibuprofen can also increase ACE2 is very much just a side note in this article. Overall, it says that the cumulative data that they've looked at suggests that ACE2 expression is increased in diabetes and that treatment with ACE inhibitors and ARBs increases ACE2 expression. They hypothesize that because of this, an increased expression of ACE2 could facilitate infection with COVID-19. So this is very explicitly stated as a hypothesis that diabetes and hypertension treatments with specifically ACE2 stimulating drugs could increase the risk of developing severe and fatal COVID-19. They also explicitly state that hypothesis needs to be confirmed, and merely are saying that if that hypothesis were confirmed to be true, then that could lead to a conflict in the treatment, since ACE2 reduces inflammation and has been suggested in recent years as a potential new therapy for inflammatory lung diseases, cancers, diabetes, and hypertension. They also recommend that we investigate whether there may be a genetic predisposition for folks to be at a higher risk of SARS-CoV-2 infection, which again leads to the COVID-19 illness. Now, they have also said that could be due to ACE2 polymorphisms that have been linked to diabetes mellitus, cerebral stroke, and hypertension, specifically in Asian populations. Genetic polymorphisms are just differences in DNA sequences among individuals, groups, or populations. It may be a single nucleotide polymorphism, which means that one of those fundamental nucleotides, those building blocks of DNA, like G, A, T, and C, those are the 4 types that we have as humans, may change from a G to a C, or from an A to a T. So that is a single nucleotide changing. You may have a sequence like GATTACA repeating. You may have insertions, deletions, or them also being recombined. That's what a genetic polymorphism means, and that's fairly common. If you think about how humans have different blood types, that is a polymorphism. That just means there's a difference in our DNA sequences. So when we say ACE2 polymorphisms, we're just saying that there are several differences in how that can be formed in your body and still be called ACE2. It also just means that different types of these ACE2 polymorphisms may increase your risk for or expression of diabetes mellitus, cerebral stroke, and hypertension, specifically in Asian populations, as those are primarily the studies in which that has been examined. So to summarize, the sensitivity of an individual person might result from a combination of the medication they may be taking as well as their specific ACE2 polymorphism when it comes to the sensitivity and risk for folks in taking these ACE inhibitors and ARBs at the same time you are having COVID-19 active infections. So, the authors of this article, Fang et al., said that they suggest that patients who have cardiac diseases, hypertension, or diabetes who are treated with ACE2 increasing drugs may be at higher risk for severe COVID-19 infection and should be monitored for ACE2 modulating medications. So anything that changes your ACE2 regulation, like the upregulation we discussed earlier that comes about with some ACE inhibitors or ARBs. So they based their research on a PubMed search from February 28, 2020 as well, and did not find any evidence that suggested that antihypertensive calcium channel blockers increased ACE2 expression or activity, and they have proposed those as an alternative treatment for patients who may be on ACE inhibitors or ARBs. So that's really all this article was getting at, was that they found some comorbidity regarding cerebrovascular diseases and diabetes in folks who have died with the COVID-19 infection. That is what they're saying. So they have found that there was about 20% for both cerebrovascular diseases and diabetes, more or less, in these 3 different studies. So they've found some correlations, but they've not found the causation for it. They are merely hypothesizing that it may be due to upregulation of ACE2 that is associated with treatments from ACE inhibitors, ARBs, and ibuprofen. They clearly state it's merely a hypothesis. They do not have more data to back this up, and the ibuprofen comment is merely a one-liner in this. It's just a side note to say, hey, we've noticed that there is a certain amount of folks who have diabetes or these vascular diseases at the same time they've had coronavirus, and that these things are treated by ACE inhibitors and ARBs, which tend to cause upregulation of ACE2. Hey, by the way, ibuprofen can also increase ACE2. They don't even discuss the magnitude of how much ibuprofen can upregulate ACE2, or if it is even comparable in the quantities of ACE2 upregulation when you compare ibuprofen versus ACE inhibitors, or looking at the different amounts you would have to take of ibuprofen to cause that same amount of upregulation that you see with these ACE inhibitors and ARBs. It may not even be statistically significant. Think back to our wine episode in which we discussed how rats were found to really benefit a lot from resveratrol, but that humans would have to drink hundreds to thousands of glasses of wine per day to get those same beneficial effects that the rats were getting, because they were giving it to them at such high doses, and rats and humans are quite different. Again, that is what we are kind of seeing here, is that the statistical likelihood and the statistical difference in the comparisons between these groups has not really been looked at yet. This is just Fang et al. Expressing an abundance of caution and also the needs for further study. In that way, it is not unlike any other study. There is certainly no need to panic at this point, But if you are more comfortable in the meantime using Tylenol, then go for it. But don't panic if you go out and they are out of acetaminophen or Tylenol, the brand name, in the grocery stores. This is merely an observational correlation study and is meant to prompt further research. It is not saying that it is causative at all, and it is a well-known fact that people who have these vascular diseases as well as diabetes tend to have more trouble healing in general. It may be merely correlation and not causation. We need further studies to tell us that. I hope that this episode has really helped break down some of the fear and confusion surrounding the use of NSAIDs in general and in particular with coronavirus today. Thank you for listening to the GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'd like to ask that you please remember to subscribe to the show, and writing a nice review always really helps us. Also, if you could please follow us on Facebook, Twitter, and Instagram, I'd appreciate it. Thank you kindly, and have a good night.
You've been listening to the Golden State Media Concepts Health and Wellness Podcast, part of the Golden State Media Concepts Podcast Network. You can find this show and others like it at www.gsmcpodcast.com. Download our podcast on iTunes, Stitcher, SoundCloud, and Google Play. Just type in GSMC to find all the shows from the Golden State Media Concepts Podcast Network, from movies to music, from sports to entertainment, and even weird news. You can also follow us on Twitter and on Facebook. Thank you, and we hope you have enjoyed today's program.